So these first three slides are kind of what I'm calling COVID 101, which is to give you kind of the brief overview with a bit of science tied in, but just really kind of a layman's explanation of what the coronavirus is all about. And you see a beautiful picture of it in the right-hand corner. This is the little devil that's causing us so many problems here these days. And just know that the science is really coming fast and quick. The medical journals every couple weeks are featuring a lot of the articles about SARS-CoV-2, which is the technical name of the coronavirus that's impacting us right now. What we do know is that it's very closely related to the SARS-CoV-1 that kind of raised some havoc back in 2003. And we do know that it just really emerged in the end of 2019, November, December is when we first kind of learned about it, and the scientists kind of identified it as being separate and different from COVID-1. Just so you know, COVID-2 is technically the disease name and the diagnosis that folks are getting in the hospital, because there are so many other coronaviruses and some that are the common cold that have been around for a while. It's the uniqueness of COVID-2 that causes COVID-19, and that's what's obviously in the news now. It's pretty important to kind of think about the illness presentation and kind of what this looks like, and this is kind of the main impetus for me creating these videos, is because 80% of people out there are getting mild to moderate symptoms, and they're convalescing and staying home to get better. In the news, we're seeing all about the 5% of severe symptoms, the critical care, and even the 15% symptom folks who are going into the hospital and requiring some hospitalization care. But the vast majority of people are getting mild to moderate. It's pretty nasty illness in many cases, but they're staying at home to convalesce, and that's like the whole point of the remaining videos that I'm going to have in this series as well. We do know the incubation period is what's kind of making things kind of tough to pin down, because people are infectious and spreading the virus without showing any symptoms at all, while it kind of ramps up in the body's system. Hence the whole social isolation work that's being done in our communities today. The mean incubation period is just under 5 days. 4 or 5 days is when people are typically getting sick, and then 90% of all cases are showing signs within 11 days. So that's kind of the whole idea behind kind of the 14-day isolation period, when people were coming from international travel or coming home and needing to isolate for 14 days, just to kind of rule out that they wouldn't be a carrier with no symptoms for that period of time. A really important point is that the mild symptoms that kind of initially pop up can look like other colds, other bugs that are kind of happening in our communities these days. Some of them are seasonal allergy-like in nature. I have seasonal allergies, and I've been waking up miserable with cough and kind of sore throat and stuff. After I take my allergy medicine in the morning, I feel great after about a couple hours. So that's kind of also confusing a few people who think they might have this coming on, and it's very similar to other symptoms that folks might have, especially in this kind of cold and flu season that is pretty typical here. The main signs and symptoms are talked about a lot in the news, so those shouldn't be new to a lot of you, but fever is common, although it might be absent. And what I'm kind of reading about is that it kind of comes and goes. People might spike a fever to like 102, 103, even 104, and then it'll go down a few hours later with or without the help of Tylenol. People often are coughing and shortness of breath. Those are kind of the telltale signs that most people are getting. But the cough might be dry because kind of the mucus and all this stuff that's forming is quite deep in the lungs, and it's kind of hard to kind of like pull that up. All the action's happening way down deep in your lungs. I have a picture over here to the right of kind of the alveoli, which are like the little air sacs at the bottom of your lungs. The left side of the picture is kind of what a healthy air exchange with the blood system should look like, and on the right side is when there's like acute respiratory issues. You can kind of see the inflamed kind of purple lining of the alveoli, and that's what's happening. That's kind of the mechanism that happens with SARS-CoV-2 infection as well. Fatigue is often a common first step. first sign of the illness, and then we're hearing kind of a lot of anecdotes about people losing taste in their mouth. There's no science behind that quite yet, but it's kind of common enough now that people are kind of identifying that as kind of an initial sign that something might be happening. But we're not seeing very often, but some people do report having some stuff that they're coughing up. They might have headache, they might have diarrhea, and some GI, gastrointestinal issues as well, but not as much as, again, those kind of 3 to 4 kind of telltale signs that the illness is coming on. There's been a lot said about children and the coronavirus kind of manifesting in kids. It's rarely kind of blowing up and showing the dramatic signs of illness and respiratory disease. I get daily updates from my colleagues at Children's Hospital, and there's been a couple kids in this past week. They've been in, kind of monitored for a few days and released. So much shorter illness course and severity than what we're seeing in adults, pretty much from late adolescence, of course, through the senior age lifespan. And then the length of the illness once sick is usually a couple weeks, but it really kind of varies depending on the severity and then how much medical support you might need. So you'll see in a few slides, in a couple more presentations, kind of waiting about a full week after symptoms stop before you get back into normal routine. So my last slide here, kind of giving the background of COVID-19, is about the transmission piece. And there's been a lot in the news, and it's been pretty inconsistent how it's reported about how long the virus can kind of like stay aerosolized or kind of on surfaces. So what I did is I just copied and pasted the main study that came out last week in New England Journal of Medicine that took samples of the coronavirus in very controlled lab settings at 40% humidity and put it on copper surface, cardboard surface, stainless steel, and plastic to kind of see how long it lasts. And if you can kind of zoom in here, you can see that a lot of the dots kind of die pretty immediately once on the surface, and then there's a few that kind of last 2-3 days depending on what the surface is. So that's been a lot of the background between people worried about kind of how long it can last on plastic or at playgrounds, grocery bags, and I just want to caution that this is a good study, but it's one study that was done pretty quickly over the last couple months, and the research is still kind of coming out about that lifespan of the virus. In the hospital, the general COVID patient, the healthcare folks in the hospitals are using droplet precautions, which means they're wearing gowns, masks, eye protections, and gloves. Those who are kind of intensively doing more in-depth procedures that might kind of produce sputum and bigger droplets are using the N95s and the respirators. But in public, the general public, kind of the idea of wearing a mask out in public to protect yourself is really to kind of protect others from getting the virus if you might be a carrier. But I saw one video that the great piece of advice was a mask is helpful for the general public out and about, just to kind of get in the habit of keeping your hands off of your face if you happen to touch a surface that would have coronavirus on before you would actually be able to get home and kind of wash your hands. So the visual that you see on the right side is kind of my favorite one that kind of shows and describes kind of what large particles and droplets, which is more like the SARS-CoV virus as opposed to like the blue trajectory of what's typical maybe of like a tuberculosis bacteria, and how it doesn't really float out in the air and go beyond, again, the 6 feet radius. It kind of like comes out of an infected person, kind of drops and kind of falls to the ground. So that visual has just been really helpful for me to kind of understand that transmission.